Hi viewers, today we will be talking about anemia. Let's do an overview of anemia. Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body tissues. Having anemia, also referred to as low hemoglobin, can make you feel tired and weak. There are many forms of anemia, each with its own cause. It can be temporary or long term and can range from mild to severe. In most cases, anemia has more than one cause. See your doctor if you suspect anemia. It can be a warning sign of some serious illness. Treatment of anemia, which depends on the cause, range from taking supplements to having medical procedures. You might be able to prevent some types of anemia by eating healthy, varied diet. There are different types of anemia, like the aplastic anemia, iron deficiency anemia, sickle cell, thalassemia, and different types of vitamin deficiency associated anemias. These are some of the common types. Now the symptoms of anemia, they can be varied, but there are some general symptoms associated with each type of anemia, that are easy fatigability, generalized weakness of the body, pale or yellow skin coloration, irregular and mostly increased heartbeats, shortness of breath, dizziness or lightheadedness, sometimes chest pain, cold periphery, and headaches. At first, anemia can go totally unnoticed, but the symptoms worsen as the anemia worsens. When to see a doctor? Make an appointment with your doctor if you feel fatigued and you don't know why. Fatigue has many causes besides anemia, so don't be assumed that if you are tired, you must be anemic. Some people learn that their hemoglobin is low, which indicates anemia, when they donate the blood. If you are told that you cannot donate because of low hemoglobin, make an appointment with your doctor. The cause of anemia, it can be due to some conditions present at birth, known as congenital causes, or they can be developed during the lifespan, known as acquired causes. Anemia occurs when your blood does not have enough red blood cells. This can happen because of three main causes: when your body doesn't make enough of the red blood cells, or bleeding occurs, you lose blood cells more quickly than they can be replaced, or your body destroys red blood cells. Now, what is the function of red blood cells in the body? Your body makes three types of blood cells. The first are the white blood cells to fight the infection, the platelets to help you blood clot formation and prevent bleeding, and the red blood cells which carry oxygen from your lungs to the rest of your body and the carbon dioxide back from the body towards the lungs. The red blood cells contain a pigment known as the hemoglobin, which is an iron-rich protein that gives the blood its red coloration. The hemoglobin enables the red blood cells to carry oxygen from your lungs to all parts of your body and carry carbon dioxide from other parts of the body to your lungs to be exhaled. Most blood cells including red blood cells, are produced regularly in your bone marrow, which is basically a spongy material formed within the cavities of majority of your bones. To produce hemoglobin, the red blood cells require some raw material in the form of iron, vitamin B12, folate, and other micronutrients which are present in our food. So the cause of anemia can be due to deficiencies of some of the nutrients, and the anemia can be classified as per these causes. The topmost is the iron deficiency anemia, which is the most common type of anemia and is caused by shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body cannot produce enough hemoglobin for the red blood cells. Without iron supplementation, this type of anemia can occur in pregnant women. It's also caused by blood loss, such as from heavy menstrual bleeding, and ulcer in your stomach or bowel, cancer of the large bowel, or regular use of some of the painkillers that are available without prescription, especially aspirin, which can cause inflammation of the stomach lining and cause the blood loss. It is important to determine the source of iron deficiency to prevent the recurrence of anemia. The second type is the vitamin deficiency anemia. Besides iron, your body needs folate and B12 to produce enough healthy red blood cells. A diet that is lacking in these and other key nutrients can cause decrease of the red blood cell production. So people who consume enough of the B12 aren't able to absorb the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia. The third type is the anemia of inflammation or anemia related to chronic diseases. Some people with chronic disease like cancers, HIV and AIDS, rheumatoid arthritis, and some sort of kidney diseases and other diseases like Crohn's disease, they can interfere with the red blood cells production. Aplastic anemia is another type of anemia which is rare but a life-threatening anemia. It occurs when your body doesn't produce enough of the red blood cells. The causes of aplastic anemia include infection and certain medications, autoimmune disease, and exposure to toxic chemicals. Anemia associated with bone marrow disease. A variety of diseases such as leukemia and myelofibrosis can cause anemia by affecting the blood production in your bone marrow. The effects of these types of cancer and cancer-like disorders vary from mild to severe and life-threatening. The hemolytic anemia is a group of anemia that develops when the red blood cells are destroyed faster than that can be replaced by the bone marrow. Certain blood diseases increase red blood cells destruction. You can inherit hemolytic anemia or you can acquire during your life. Sickle cell anemia is an inherited and sometimes serious condition. Is a hemolytic anemia caused by defective formation of the hemoglobin that forces the red blood cells to assume an abnormal crescent shape or sickle shape. These irregular blood cells die prematurely, resulting in chronic shortage of the red blood cells. Now, who are at risk of developing anemia? People with diet lacking in certain vitamins and minerals like iron, B12, folate, and copper, etc., are at risk of anemia. People with intestinal disorders like Crohn's disease, celiac disease are at risk of anemia because the nutrients, even if they are taken, they cannot be properly absorbed. Either if you are losing blood acutely or chronically by heavy menstruation, or if there is an ulcer in your stomach, if the production is less and your blood loss is more, you can develop anemia. Or if the demands are high, like in growing age or in pregnancy, you can develop anemia. Some chronic conditions like cancer and kidney failure, they can slow down the production of enough red blood cells and you can develop anemia. If you have family history, you can inherit the condition from your parents and can suffer from anemia. Other factors like history of certain infections, blood disease, and autoimmune disorders increase your risk of developing anemia. Alcoholism, exposure to toxic chemicals, and the use of some medication can affect the blood production and lead to anemia. If you are older age, you can develop increased risk of developing anemia because your body is weak, your digestion is weak, and your bone marrow is weak, so you are at risk of anemia. Now, if you are anemic, you can develop certain complications like extreme fatigues, pregnancy-related complication like premature deaths, premature births, and certain congenital disorders. You can develop heart problem in the form of heart failure and heart attacks, and even death can occur from anemia. Now the prevention is very much easy. Iron, folate, B12, vitamin C, etc. These are the raw material required for production of the blood cells. So the diet should contain all these requirements, and pre-marriage counseling